So poliomyelitis or polio, it is a crippling and potentially deadly infectious disease. It is caused by the poliovirus. The virus spreads from person to person through the fecal-oral route and can invade the person's brain and spinal cord, causing the paralysis. Then incidents in India, there is no reported case since January 2011. Then fully eradicated. India is fully eradicated on 13 January 2014. The types of poliomyelitis based on severity of infection. There are three types: abortive poliomyelitis, non-paralytic poliomyelitis, and paralytic poliomyelitis. Then in the first stage, abortive poliomyelitis, there is no symptoms. Okay, there is no symptom. This is the mildest form and is the most common form. In the second, non-paralytic poliomyelitis, some of the symptoms like stiffness of the neck and back are there, but there are no paralytic. But in the last one, it is paralytic poliomyelitis. The virus will enter the CNS, and there will be paralysis. Okay, mainly in the muscles, including the muscles of the leg. Okay, then types based on the location of central nervous system. There is a spinal polio. First one is a spinal polio, second is the bulbar polio, and third one is the bulbospinal polio. In the first one, this is the most common type, characterized by asymmetric paralysis. Here, different spinal nerves are involved, and injury to the anterior horn cells of the spinal cord will be there. Here, the lower limbs are most commonly affected, and the common signs and symptoms are tenderness, weakness, then flaccid. Bulbar polio, it leads to weakness of muscles innervated by the cranial nerves. Here, there will be mainly affecting the cranial nerves. Here, the signs and symptoms are mostly dysphagia, then nasal voice, fluid regurgitation from the nose, then difficulty in chewing, facial weakness, and diplopia. Then in the last, bulbospinal polio, it is a combination of bulbar and spinal. Both symptoms, signs and symptoms will be shown in the patient. Then next is the causes and risk factors. It is caused by, we all know it is caused by the enterovirus known as poliovirus. Then risk factors: age, mainly infants and elderly. Then sex, no sex ratio difference, but in some countries male are infected more. Then living with the infected person, then immunocompromised patients, then lack of immunization, that is lack of polio vaccination or polio immunization. Okay, then extreme stress or strenuous activity, travel to an area that is experienced and polio out. Next is the pathophysiology. Here in the pathophysiology, what will happen? First, the poliovirus will get transmitted by fecal-oral route through ingestion. Then inhalation or entry to the conjunctiva of droplets of respiratory secretions may be possible. Most of entry in close context. Okay, in close context there will be ingestion, but in close context they will experience the inhalation also. Okay, after the virus is inhaled through the droplets, then it will enter through the respiratory system. Then the virus will multiply in the epithelial cells, then it will spread to the lymph nodes, then it will enter the bloodstream. After further multiplication, the virus will enter the bloodstream again, carried to the spinal cord and brain. So here incubation period is usually 7 to 14 days. Same pathogenesis, there will be mode of entry through the mouth, there will be local multiplication, and minor or primary viremia will be there. Then secondary or major viremia will be there. That means there will be multiplication or infection in the bloodstream by the virus. Then after that, it will reach the spinal cord and brain and multiply in the neurons. Then lesions are mostly in the anterior horns of the spinal cord. Here also the same After ingestion, it will reach the small intestine, and primary replication will be there. Then after that, it will pass through the lymph nodes, then bloodstream, then central. It will come to the central nervous system. Then it will cause paralysis. And signs and symptoms, mostly 1 out of 4 people with poliovirus infection will have flu-like symptoms that may include sore throat, fever, tiredness, nausea, headache, stomach pain. These symptoms usually will last for 2 to 5 days. Then in the non-paralytic aseptic meningitis, the signs are tripod sign, kystenitis, head drop sign, and neck rigidity. In the tripod sign, what will happen while leaning? The head of the patient will be leaning forward, and it will support the patient will support their arms on the knees, like tripod, like the tripod. Okay. Then leaning forward, supporting the hands on the knees. This is known as the tripod sign. It is also seen in a COPD patients. This is caused due to meningeal irritation in poliomyelitis. And next is a kystenitis. Here in this, the knees will be kept down. Then the patient will be asked to kiss his knees. While saying so, the patient will not be able to bend forward. Okay, because there will be stiffness in the spinal cord. Then unable to bend forward, the knees will automatically rise up. This is known as the kystenitis. The serious symptoms that affect the brain and spinal cord are paresthesia, meningitis, paralysis. Then diagnostic evaluation include assessment and history collection. Culture can be done from throat, urine, and stool, but it will be mostly the virus will be mostly present in the stool rather than urine or throat, or even blood or spinal cord. Then in the serological testing, a 4-fold tighter rise between acute and convalescent specimens suggest poliovirus infections. So the viral load will increase, 4 times increase will be there in the viral load. Then estimation of antibodies, IgM. And then in the lumbar puncture or spinal tapping, there will be increased white blood cells and mildly elevated protein. Then in the management, the main goal is to control the symptoms while the infection runs to its course, as there are no specific treatment for the viral infection. Then symptomatic management includes treatment of pain or fever with analgesics, antibiotics for secondary infections, flu therapy, bed rest, adequate diet, minimal exertion and exercise, hot packs or heating pads for muscle pain. Prolonged rehabilitation may be necessary, including breast, spleen, or surgery if the patient cannot be able to walk or stand. Then hospitalization may be required. Then physiotherapy for. Then nursing management. After the complications include respiratory complications, cardiovascular complications. Respiratory complications like pneumonia and pulmonary edema, cardiovascular myocarditis, core pulmonary hypertension. Late complications include soft and bone deformities, and then osteoporosis, chronic distension of the colon. Then prevention we can do through the active immunization of the polio or the polio immunization. There are 2 types of polio immunization. Inactivated polio vaccine, that is the IPV, which is given in the leg or arm. Then oral polio vaccine, it is also known as a trivalent polio vaccine. So it is given in 2 months, okay, in infants with 2 months. Then after that, in a 2 months interval, second and third dose are given. Then the fourth dose is given at 18 months of age. And for the IPV, it is given at 2 months, 4 months, and 6 to 18 months, and after that 4 to 6 years of age.